and welcome to MedCity's Pivot Podcast. Today we're talking about pharmacy benefits management and a more flexible approach to it. Now, each year, employers and payers are battling the rising costs for providing pharmacy benefits. There is some evidence to show that they're looking for new approaches to manage and rein in these costs. In fact, Mercer published a study earlier this year that showed that 61% of employers with 500 or more employees were reevaluating new approaches to either manage or offer the pharmacy benefit. In fact, there is some evidence also that companies and payers are reevaluating their current relationships with their PBMs. So, what is this flexible approach? We have two guests today that will help address what those new approaches to pharmacy benefit management can be. We have Adriana Ramirez, President and Chief Operating Officer of Abarca, a modern PBM, and Matt Gibbs, President of Lark Health, which offers coaching round the clock for people battling chronic conditions. This episode is sponsored by Abarca. Hello, Matt, and hello, Adriana. Welcome to MedCity's Pivot Podcast.
Hello. Thank you
Having us.
for having us.
So, Matt, let's start with that quick definition. What do you actually mean by a flexible or modular approach to pharmacy benefits management?
Sure. I like to think of it as, we've all been to an all-you-can-eat buffet, whether we want to admit it or not. And you go and you pay your $20. You've got all these options to eat. But all you know is you paid $20. So if you ate nothing but crackers, they made a lot of money that day. If you ate prime rib for an hour, they probably lost money. But here's the thing, you never know what you really ate in terms of your value. And that is what's kind of thinking about the food metaphor here with PBM. It's sort of an all-you-can-eat scenario where you're able to pay a certain price and you get a whole set of services, but you don't really know what those individual services cost. And if you try to negotiate one thing, everything else moves along with it.
Mm-hmm.
And so when you break it apart, you get visibility into what we would call unit economics, which puts you in a much better negotiating place and gives you visibility into your actual costs by service stream, if that makes sense.
So, yeah, it does. So, Adriana, if you could drill a little bit deeper into that, given that you are a flexible, PBM, you've adopted that approach within your company. Talk to me a little bit about how that system works. In other words, when you go to a payer or if you go to an employer, what are the strengths that you can say you are very good at? So then they can decide, okay, you know what? We're going to go with Abarca for this and this and this.
Well, I think that the point that Matt makes is really important because there is the whole piece around transparency is critical. So that's the first. But what we're hearing from payers is the market is changing. They're demanding more of payers, not only in terms of affordability, but differentiation to compete and to really better serve their members. So if you're in a traditional PBM model, you generally get the standard offerings available.
Right.
There's really limited, if any, opportunity to customize and integrate other solutions into the mix. So payers are having really an appeal for a more flexible model. It just allows them to differentiate, to have better control and customization, and not to be beholden to one single entity. One of the things that we bring to the table, not only that from a philosophy perspective, we're agnostic in terms of the different entities that a client may want to bring to the table. Us also the piece around the technology, which is Darwin, which is really the foundation for enabling a successful flexible model. The other thing I'll say is pharmacy care touches so many domains. Right. Clinical care, digital engagement, specialty drug management, network, and the list goes on and on. The expertise that's needed across all those areas just doesn't always live inside a single organization. Our philosophy is we don't pretend to be all things to all people, and we really believe that no single company can be the best at every single component of the pharmacy care. And from our perspective, a flexible PBM model really gives payers a backbone, in our case, Darwin, but it really allows them to plug and play in bringing in the right specialist partners
Mhm.
where they believe it truly matters. So let's say they may want to bring a particular partner to do specialty capabilities that they wouldn't get with their boxed PVM solution that they have.
Right.
In our case, our position is come on, absolutely bring it to the extent that that serves to differentiate and to really provide something new to the market. Why not? So for me, like the piece around allowing the payer to have control, customization, and the point that Matt brings around more transparency
Mhm.
is really combined with the piece around the technology really has been differentiating for us. And like that's what we're hearing from the market. There's a lot of appetite for that.
Mhm.
The last I'll share there is that because there is a plug and play of different entities that are that the client may want to bring to the equation, they have the option, depending on how the market is shifting and their needs, to plug and play.
Right.
So they don't need to be stuck to one solution um, throughout. Right, a lot of these PBM relationships last for a long time because it's very difficult to uncouple. But if it's already uncoupled and you have a very strong technology partner and foundation that is flexible, not only from a technology perspective, but from a service mindset perspective, that plug-in and playing to adapt to the client needs is much more flexible and attractive.
So, Matt, Adriana mentioned the lack of transparency, which has dogged all the legacy PPMs, and there's so much, that's in discussion right now to make this world a little more less opaque, may I call it. So, do you think this flexible approach gets to the heart of the transparency problems? Do you think it makes payers feel more confident in the contracts that they sign?
I would say generally yes. There's also a little bit of, hesitancy, right? So it's an investment for a health plan in particular to invest enough individuals to manage a multi-component process like this.
Right.
It's not one contract, one audit, one review anymore.
Right.
You've got five, right? If you're doing your job right. But I think what health plans have realized is not having that visibility is a bigger risk than having it and hiring a few extra heads to get it done. So you're kind of in this point where pharmacy costs for the first time could, in many cases, pass medical expenditures. When pharmacy was 10 to 15%, one contract because people weren't paying attention.
Right.
But now they have to pay attention. Everything from GLP-1s to Humira.
Right.
If you're not managing even at the drug level now,
Right.
your benefit's going to go upside down.
Right.
So having these components makes that easier.
So, Adriana, let me talk to you briefly about this. There are folks out there that feel that you really don't need PBMs anymore. There are this idea of going directly to, employers can go directly to drug manufacturers, and certainly we're seeing some movement in the marketplace. So, flexible or not, what's your take?
I think those scenarios will continue to happen. I mean, we're seeing it with all these manufacturing organizations allowing members to go directly to them, and we see that in terms of how members are wanting to engage
Mhm.
with their healthcare differently. But I don't think PBMs are going away. I do think that they will transform, and with all the conversation around rebates and those will transform into something else. But you need somebody to process your medications. I
Mhm.
don't think we want to go back to nor go closer to how the medical transactions take place today. I think PBMs have a lot of evolution to do, and there's a significant change that really the industry, the members, payers are asking for. That's happening. I think flexible models really are another way of tackling the black box PBM models that we've seen for since PBMs got created.
Mhm.
And I also think that the piece around I'd be interested in what Matt thinks about this, but the piece around regulation continuing to change, like there's so much more scrutiny around from a regulation perspective and so much
Right.
pressure to change that I do think that transformation is happening. That doesn't happen from one day to the next. It's going to take time, but I don't think PBMs are going away anytime soon.
Matt, do you agree?
I don't think we want them to go away. I don't think I'm old enough when I was a practicing pharmacist. It was something Adriana mentioned the black box effect. What is something called the shoebox effect, where you literally used to keep your receipts and then manually submit them to your health plan for reimbursement. That is what people would have to do if PBMs weren't in existence. And I know Americans, they have no idea. They love paying that copay and being done.
Yeah.
So if you want PBMs to be gone, you now have to pay and then submit. I don't see that happening in any world. So I agree. They're around. Are they going to be around in the way they are today? Absolutely not. A lot of the things that Adriana said, and I agree. Just yesterday, I was overhearing on the news, Republicans were talking about their kind of framework around their bill. The second thing they hit on was breaking up of the PBMs. I was very surprised to hear that, in particular from that administration. So it's fascinating. You now have both sides of the aisle that agree we have to do something here, and that rarely happens. And when it does, something will probably happen.
Oh,
Yeah.
there's definitely bipartisan support, and
Yes, change is coming. It has. I feel just as an sort of observer of the industry that it has come down to even mainstream people realizing and knowing these terms. That wasn't true even 5 years ago. So I think you guys are totally right. There's regulatory changes happening. Matt already addressed the idea that you're dealing with multiple different vendors, right? As a payer, if you move to that flexible model. Adriana, I want you to talk about it a little bit. Again, from my perspective, we often hear about, people, large companies not wanting to deal with multiple point solution vendors. I understand that your approach is, let multiple players work with payers based on their expertise and their strengths. But when you have to manage those 5, 6, 7 contracts, how do you do that? What is, when you approach people and they are hesitant, how do you convince them that this is totally worth your time?
that's a great question. I mean, bringing in multiple partners, it can really seem to create a lot of fragmentation and complexity. I agree with Matt on his perspective there. And if you don't have the right system to integrate it all, I mean, it can be very, very challenging. And not all PBMs can do that. I mean, they don't necessarily have the technology backbone to do it, nor the mindset around the flexibility. So that's one piece. But done well, I really believe that flexible PBM models, it's not just about juggling point solutions. And you don't need to plug and play 1,000 solutions either. I mean, it could be just a handful of very tailored solutions that you want to think about differently. And that in the current, more traditional PBM model, you just can't. What we hear from a lot of payers is, I want to integrate with this particular partner. I'm not going to share names. I want to integrate with this particular partner, and my PBM just can't, or they're unwilling to do it because that just doesn't scale as easily for them, and they don't have the technology to do that. So I really think that the flex model is really about combining those specialized capabilities. It doesn't need to be absolutely everything. It can only be it could be a handful that really truly make a difference inside a more unified system. But that needs to be paired with a service offering that makes it seamless for the health plan. The expectation that many health plans or employers, let's say large employers, can just take on and do a flex model and have all these many vendors and integrate them without having a very strong backbone from a technology perspective with your PBM, but also on the service offering to make it a unified experience from a service perspective is critical. So one concept that I've been thinking, and I know Matt shared the buffet example, so I won't use food. I'll use something else as an example, but think about it as your smartphone. You don't really rely on one giant application that tries to do absolutely everything. You use different applications that are built by different entities, but because your operating system integrates them all, it really feels like a cohesive experience. Right. So in the case of a flexible PBM model, for example, you need to integrate all the data. It needs to be one system. It needs to be one performance framework. It needs to be one member experience. And relying on your PBM So you still have the control and you have the flexibility. But I see the PBM sort of the brain, relying on your PBM to be able to not only integrate them, but be that entity with you so you can take control whenever you want,
Yeah.
but with you to coordinate the work with those vendors to make it a more holistic and seamless experience is the conversation that we're having with payers. So I see it as it's not about multiplying the complexity, but it's multiplying the capability and leveraging the partner that you select for the brain, right? The engine to really be able to support you in that coordination so that it looks like the smartphone experience. So
I
not
love
not
that analogy.
right.
Yeah.
I've been thinking about that one lately,
Better
and I've
than
been
mine. That was better. You can tell I'm hungry.
No, I love that analogy.
I'm thinking of egg rolls. And you mentioned that buffets are
Okay, Adriana, staying with you for a little bit, we've talked about how it is better for payers adopting this flexible approach. Let's talk about the patients. How does the patient experience change as a result of this sort of approach?
for the patient. It should be seamless,
Okay.
but to the extent that the payer selects partners that, let's say, they want to choose a partner that's the best at that member engagement experience, like the holistic experience for the member is going to be significantly better than just the off the shelf approach that every PBM model provides today. So a lot of that will have to do with how the payer is working with the selected PBM and also what are those specialized partners that are being brought to the table to engage with the member in a way that seems as it's all part of a system, but
Mhm.
that truly delivers a better experience for the member.
Makes sense. Matt, we can't have any conversation in healthcare these days without addressing AI. So I will have to bring AI into the discussion here. Can you talk to me a little bit about how AI is being leveraged both on the payer side and the PBM side to make the pharmacy experience a little smooth for patients?
Yeah, I think healthcare is like a lot of things tends to be a little slower on the tech embracement side of things. But I think the efficiencies that can be gained, and I don't when I say this, I don't mean cost efficiencies, although there are some. To me, it's clinical efficiencies. If we were really good at what we're doing, we wouldn't be ranked like 30th in the world in healthcare, right?
Right.
So we're not really good at what we do.
Mhm.
So having any help we can get, whether it's processes, policies, machinery, AI, whatever it is probably only going to help. And I think what you're seeing kind of is the earliest adoption of this is in kind of the digital health space
Mhm.
is where kind of the safer area where people, I should say safer, where people feel more comfortable about coaching on nutrition, on meal planning,
Right.
on exercise. And then now you're going to see it start migrating into healthcare itself.
Mhm.
And there's obvious areas within the PBM ecosystem, everything from how you review clinical protocols, how you're able to put in massive amount of literature to have it reviewed to come up to give your pharmacy and therapeutic committees better decision making, more informed, more holistic. You're not digging through textbooks, which is literally kind of what happens today, even though it's online. So there's a lot of things that can be done even in the research and gathering that will help PBMs make better clinical decisions for what they pick on formulary, where they place it on tiering. And then the obvious one is what can be done in the authorization area, both on the medical side and the pharmacy side.
Right.
I don't think we're ever going to get into a place because a lot of it's statutory that you're going to have AI deciding yes or no. They may decide yes, and yes, you get coverage, and the no's still have to be reviewed by a clinician.
Mhm.
That's right. Things will go because today, it's just a surprise to everybody. Generally, there's not a clinician reviewing your prior auth. It's a technician.
Right.
And if it's a yes, it goes on. If it's a no, it goes to a pharmacist. So I think there's a little bit, but it's going to be slow entry into those decision-making pieces because people get a little nervous around it.
Right, right. Although though now, people are talking about agentic AI and all of that, and they'll be able to take some tasks. It's a very interesting, thing with AI. I mean, the humans need to be in the way, but out of the way also. So it's like a really
Yeah.
interesting balance. Adriana, Abarca is a tech-enabled modern PBM. So I'm very curious about your take on how you're leveraging AI internally.
Well, we've taken a position that we don't want to go all into the AI buzz, but we definitely have been working with AI on different of our applications. Uh, I think that our healthcare experience, and others at Abarca will share the same, is very unhuman in a lot of ways. If you navigate our system day in and day out, it's very complicated, and we have a lot of opportunities to really reduce friction and enable a more personalized support. We're focusing from a payer perspective. We're really focusing right now on the pieces that Matt was sharing around prior auths, where there's so many tasks that can be automated and really reduce that admin burden that right now, whether it's a tech or a pharmacist, like they're doing a lot of the admin work. 30-40% of what they're doing, if not more, is really around how to manage the administrative tasks, and we're really doubling down there on the AI front for prior ops, so we can give clinicians the space to really focus on what they're trained for. For members, we also see a huge opportunity to make care simpler and help people navigate the system. And we're working on some things there as well. But I'm with Matt in terms of how do you progressively incorporate AI? And I think from a regulatory perspective, it's still going to be hard for that member engagement directly. Like we got to tread a little lightly there and make sure that we're not sharing any information that wouldn't be accurate. But I'll share an example from my own experience. I mean, I send, my husband's going to hate me for this, but if he ever listens to this podcast, but if I send my husband to pick up a prescription for me, more often than not, or he pays out of pocket, or he needs to try to find a way to get a copay card, or he comes home without the medication because of some rule that he just didn't understand, or the pharmacist wasn't understanding the message that was coming through, but didn't have the full context. And I mean, AI has such a potential to change that. I can imagine how it can connect with members more in real time, explain their coverage, find alternatives, really guide them through the journey. I'm sure my husband will be very, very happy when that happens. And how to help folks navigate the system. I mean, if done well, I think that AI can really make the system much, much better and more navigable, and definitely more supportive. So we believe that it's going to be extremely transformative, and that's just around the corner.
Yeah. I mean, you're so right. The idea of AI being able to reduce frustration that patients sometimes feel in their interactions with healthcare, whether it be pharmacy or something completely different. I'd love to see more of that. I'm not as afraid of AI as some folks are. I think it's inevitable. We just have to have some good guardrails around it. Let me end with a question that comes back to that flexible approach. From my understanding, it's very hard to unravel PBM contracts, and yet more and more people seem to be believing that things, business as usual cannot happen. So for those that are reevaluating and thinking about, okay, let me see if I can break this up, what advice would you give them? Matt, I'd have you go first.
All right. Putting on my old consultant hat, which I sometimes just can't get away from. To me, it's be open-minded. So in the employer segment in particular, you're never going to get fired from your job if you hire a big name that everybody knows, right? Because, they just had a glitch and something didn't work. But when you take a chance on someone that people in general haven't heard about, I mean, everybody knows the name of the big three. They won't necessarily know the name of some of the middle market PBMs. They may not know Abarca's name. And it's being willing to, what's the definition of insanity? Doing the same thing and expecting a different result. Well, the time has come now where, again, as you said, the general public now knows about a PBM, and every CFO in the country is now asking their HR team,
right,
why do we keep renewing and going with these same three? There's got to be something else out there. So this is a great window of opportunity where now there's a little safe zone for the HR folks to do something different. Is it going to be perfect every time? No, but it sure as heck isn't perfect now. But this is really the first time that they kind of have that freedom because their management is kind of demanding it, that they look at other alternatives available.
Right. Matt just did a huge promotion for you, Padre. But add a little bit to it. What would you like people to know about Abarca and your capabilities?
Yeah. I mean, the market is changing. It's extremely competitive. We're seeing it in our discussions with clients that are very interested in doing something different. And I'm with Matt. I mean, they've done the same thing over and over again. I think the market is right for something refreshing. What got us here and going to get us there in terms of how health plans are approaching their membership and also large employers. So a flex model really allows payers to design an ecosystem that really meets their needs and those of their populations. So that at the end of the day, we can have a better healthcare delivery in this country. So I think that no change is easy, but we have some experience already under our belt, and it's really exciting. The possibilities of really transforming the healthcare um, experience, starting with prescription benefits. So I think a great start is to really rethink the model and find the best partners that can deliver that.
Perfect. Well, thank you for your time and in explaining this new flexible approach to pharmacy benefits management. Thank you.
Thank you. Thank you.